Hello and welcome to the Rotary Club of Broadbrook, Connecticut's Service Above Self. I'm Ann Osborne. On this episode of Service Above Self, we'll once again be looking at the vocational side of Rotary. Rotary's Vocation Avenue of Service encourages business professionals to share their expertise with others, as well as provide information about what it would take if someone was interested in taking up that profession. Today we will be looking at the field of chiropractic with our guest today, Dr. Don Ledoux. Welcome.
Thank you for having me.
You're welcome. Can you give us a brief history of you and your practice?
Certainly. My wife and I, Lisa, own and operate Turning Point Wellness Center in Suffield, Connecticut. And for me, chiropractic really is a second career. I had my midlife crisis a bit early. So right around when I was 30, I decided I didn't need the corporate world anymore. I worked in, of course, the insurance center of the world in Hartford for about 9 years, and I realized this really wasn't my thing.
Right.
So I decided to do some soul searching and some other talents that I had, and keep a long story short, I ended up pursuing or bumping into a chiropractor after having chiropractic experience as a patient myself.
Okay.
I did some research into it, talked with a few other chiropractors that I got to know, and ended up going back to college. It was a scary time, but an exciting time at the same time, to take up a whole different avenue for me.
I bet.
But it was very interesting to find out more about chiropractic, because my experience as a patient, as most patients would, when you think of chiropractic, you think of back pain.
Yeah.
And that was my experience. And that brought me to chiropractic as a patient. I had great help with that. I was pretty impressed with how I felt after dealing with that for many years. I recovered very quickly, and I wanted to learn more. I was seeing a chiropractor actually here in Glastonbury, Connecticut. It did help me, but it didn't change my life at that point. It was when I observed a very close friend of mine going through her first chiropractic experience. She was diagnosed with carpal tunnel, and that she had gone to a medical doctor who then suggested she see an orthopedic surgeon, and that orthopedic surgeon and the medical doctor both agreed it was carpal tunnel. She needed to have surgery to correct that situation in her right wrist.
Right.
She wanted a second opinion, so she went to another surgeon's opinion. So she went to another orthopedic surgeon and also agreed that she needed the surgery. Well, unfortunately, she didn't have insurance at the time, and so it would have had to come out of pocket. So she's saving her pennies, and in the meantime, they gave her a wrist wrap, a wrist brace to support that wrist, because it was incredibly painful, especially at night. So what happened after that was she also developed headaches, which in the past she had sought chiropractic care for. So she ended up going back to a chiropractic office, which she knew had helped her with her previous headaches. The chiropractor noticed, obviously, that she had a wrist wrap on and what was going on. He got the history of that. And after his exam, he felt that there wasn't really any problem in her wrist, although she did have real pain there.
Right.
He suggested and really felt that the real cause of the problem was coming from nerve impingement in her neck. So after some treatments, in fact, it was less than 6 weeks, I believe, if I remember correctly, that she had no more carpal tunnel pain.
Wow.
So it was a very quick recovery, and that's what I said.
Yeah.
And I said, wow. After being a chiropractic patient myself with low back pain, I just kind of, that's when the light bulb went off for me, and I saw that, you know, there's something to this, and this chiropractor saw a bigger picture.
Right.
He kind of looked at the wholeness of this person and did some troubleshooting, if you will, and really dug deeper to find the actual cause, and it intrigued me. And that's where I called that chiropractor, and we spoke for a while. He took me to lunch, or I took him to lunch, one or the other, and I learned more about it. And I was so intrigued at that point, I said, that's it, I've got to go back to school and learn more. And again, at the time, I thought I was going to be a low back and carpal tunnel kind of chiropractor, because that's all I knew that it helped. But chiropractic, as I've learned, is really a primary healthcare delivery system where we can be a portal of entry for anyone into that healthcare system. And it really deals with it's a holistic entity that looks at the whole body, and that's what we do. We look at the whole body.
Can you expand on that? You know, how is it important to what we should be doing for our health? versus going to a regular doctor? You know, what is the meat of the chiropractic world?
That's a great question. I hope I have a great answer. There are two very differing paradigms in that healthcare system. We have the allopathic, or the traditional Western model of healthcare that you just touched on, and then there's the non-traditional, if you will, or not so traditional wellness model, and chiropractic falls under that model. The allopathic world really is more into a mechanistic and reductionistic view of the body. That's why, for example, we might have we do have specialists in medicine. You have your OBGYNs, you have your endocrinologists and your cardiologists and your gastroenterologists and all these specialists,
right? Because
they tend to look at the body in its various parts without actually understanding. I know they understand these things because they're very intelligent people, but how they approach it is that you know, if you have a stomach problem, you go see a stomach specialist,
right, and
they deal with that, and they prescribe some sort of medication or some sort of treatment plan, and not really taking a look at how it may affect the rest of the body. The chiropractic training is a bit different, and our paradigm is what we call holistic and vitalistic. We understand that the body works as in unison. All body parts rely on one another for the body to work in tandem and to have what we call homeostasis, which is normal, healthy physiology, everything working together for the betterment of that individual. So we look at that way in chiropractic, and that's how we're trained. So that's a pretty significant difference, I think.
Yeah, it is. It is. Are all chiropractors the same?
Not necessarily, no. Just as in medicine, there are specialties within chiropractic. But again, our training is really has a very solid foundation in that holistic approach to healing and healthcare. As far as the same, you can go to 100 different chiropractors, you're going to get 100 different types of treatments and adjustments.
Yeah.
The really interesting part is it's been studied ad nauseum that if you, all the different techniques that are taught in accredited chiropractic colleges, they're all effective and they all work. So even though you got a different adjustment from chiropractor A versus chiropractor B, they are effective and you will see results.
Okay.
So it's just, what is more important is that whatever techniques that chiropractor is proficient in, that we find the best ones for that patient to get them the best results in the quickest and quickest amount of time for the least amount of cost.
What kind of training do you need to become a chiropractor?
Chiropractic training and education is really quite extensive. I remember that, and I've done some research here before the show, that according to the U.S. Department of Labor and the Bureau of Labor Statistics, and depending on the sources you look at, there's about just under 49,000 or around 49,000 licensed chiropractors in the country. And our education is provided by 14 different universities and or colleges here in the United States, and there's others throughout the world. But here in the U.S. there's 14, and some of them have different branches as well. Most chiropractic colleges require that you have at least an associate science degree, 90 credit hours of study under your belt before you start chiropractic college. The catch is that most states require that you have a Bachelor of Science degree before you can get licensed.
Oh, okay.
So you're really better off, if you're considering having a degree in chiropractic, make sure you get your Bachelor of Science degree with emphasis in the sciences, the humanities, such as biology, the chemistries, physiology, and some physics, if you will. And make sure, and you're better off getting a Bachelor of Science degree from at that level. Once you get that, then you certainly are welcome into, with a certain grade point average, welcome into a chiropractic setting, chiropractic educational college, where it's really about a 5-year program. Most colleges, including the one I attended, allow that you go to, you can accelerate the program, so instead of taking the 5 years and have summers off like you would in a typical undergraduate summer off double semester program, you can go through a trimester program where you just get a week off between trimesters and you go year round, and you can get the whole program done in about 3.5 years.
Oh, that's not too bad.
No, it's actually quite not. If I were to do it again, I'd take the 5. It was very difficult, very challenging.
Yeah, good. Now, you mentioned there are some different specialties within the profession.
Yes.
And what are some examples of that?
Well, as in any profession, you can go further. Once you get your doctorate degree, there are specialties. I'm not aware of all of them, but the first few that jump out at me are a diplomate program in pediatrics. There's a diplomate program in orthopedics as well as neurology. And that's an additional 3 years of study at an accredited college. Some of these studies, however, are available online, so you don't have to travel to wherever these chiropractic colleges are.
Yeah.
So those are the 3 big ones that I'm aware of. There may be a few others, maybe in geriatrics as well.
Okay.
Not certain of those.
How is this different from massage therapy, physical therapy? You know, it kind of manipulates, moves your body, your spine. How is it different from those types of therapy?
That's a question we get asked all the time. You know, why should I be seeing a chiropractor versus a massage therapist, for example? Massage therapy works primarily with soft tissues. It's very important. So to help us relieve stress, it's a great immune system builder. It's a nice relaxation technique, but it also helps with restoring proper function, certainly to the soft tissues, especially that of the muscles. So if you pull a muscle, injure a muscle of some sort, lifting something heavy, or running too fast and you pull your hamstring, that's a great time to see a massage therapist to work with you on that. What they can't do, though, is what makes the chiropractic profession very unique, and that is to actually adjust the joint tissues, the bony tissue, which we'll get into hopefully in a bit more detail in a few more minutes. So they're great at soft tissue work, helping work out tight muscles, stimulating some blood flow and some lymph flow to improve immune response. The physical therapists, my understanding of physical therapy in my training is, I'm going to oversimplify it, probably, for the physical therapists out there, but their primary goal is to increase range of motion and strengthen the body. Again, working primarily with soft tissues.
Right.
Now, I practiced in New Hampshire prior to moving back home here to Connecticut, because I'm a Connecticut native, for 12 years. So I'm more familiar with the physical therapy laws and chiropractic law there. I'm very familiar with the Connecticut law of chiropractic, but not so in the physical therapy.
Right.
My head's been so involved in getting our new practice up and running that I've not taken the time to find out what the governing laws are in physical therapy. For the most part, I understand that some of them, depending on their training, do have the ability to manipulate. Now, chiropractors like to use the word adjust when it comes to actually creating a change in bone structure and how joints function.
Right.
But physical therapists, some of them may be able to manipulate in a similar way that chiropractors do. I'm not certain of that, though, here in Connecticut.
Okay.
Maybe one of your viewers will let you know that and help us out on that. But physical therapy, again, focusing on strengthening and increasing range of motion, primarily, again, working with soft tissue. Okay? And they put you on a regimen of different programs, stretching programs, strengthening programs, and they also have available to them some other modalities like electric muscle stim, maybe some ultrasound, iontophoresis, which is a way to help, again, relax the muscles using some sort of topical medication, if you will. So that also is available as a physical therapy modality.
Okay.
But the reason, what makes chiropractic, again, unique and different is that we look for something that's called the vertebral subluxation complex. And it's a neurological disorder caused by a mechanical dysfunction.
Okay.
All right, so that's a lot of big words there, right?
That's all right.
So maybe we can express or explain some of that.
Well, actually, we're going to take a break.
Okay.
And when we come back, let's explain.
Sounds great.
Okay?
Thanks.
All right. We will be right back.
Salam.
Jam.
Salam. Ewa.
Rita. Apa?
Mir.
Shanti.
เงียบสงบดี
We all want the same thing,
Peace.
and Rotary clubs
Sola.
are making it happen.
Lucky.
ข้าวชุ่ม
Through international scholarships for young people to promote peace and understanding
La Fei.
around the world.
Señales da high.
Rotary. Humanity in motion.
Mom,
What?
you can't find Ichabod.
What?
You don't have to be perfect to be a perfect parent. There are thousands of teens in foster care who would love to put up with you.
Welcome back. We are with Dr. Ledoux from the Turning Point Wellness Center, and you wanted to mention something about licensing.
Yes, I think it's important to know how we get licensure here, not only in Connecticut, but certainly in the United States. What I do want to make a correction that there are not 14 but 16 chiropractic colleges and universities here in the United States that are accredited by the Council on Chiropractic Education.
Okay.
And then once you get through the curriculum of these chiropractic colleges, during that time you are tested by the Council on Chiropractic Education and what we call the National Board exams. And there's 4 parts to that that are taken one at a time during your school during those 5 years of education. The last part, of course, is taken after the education is completed.
Right, right.
Then you've got to go and depending where you're going to be living, whatever state, you've got to go and take a look at what state licensure requirements are there, and many states are different. Most states do accept the 4-part national exam as their exam, and then you have to maybe sit for their jurisprudence, the law portion of your exam. And that's pretty much how it holds true here in Connecticut, from my understanding.
Oh, okay. All right.
So I think licensure, it's a rigorous process, and it should be, because they're looking out for the public's best interest and safety.
Absolutely.
And we have to know what we're doing and be able to make those decisions as a primary care doctor protecting the public.
Okay.
Yeah.
Now can you tell us, what is chiropractic? What do you do?
Well, we help a lot of people, Ann, as best we can, and we need to help more. Sadly, not enough people utilize chiropractic because they don't know what it is. Like me, initially, I thought it was about back pain, carpal tunnel, and headaches.
Well, crunching bones.
And crunching bones.
That's the understanding I had.
Yikes! I go crazy when we start crunching bones. But the reason I cringe reason we crunch bones is really it's not about bones at all. Chiropractic is about the proper functioning of your central nervous system, which really is your brain, but your brain doesn't stop at the base of your skull. Your brain continues inside your body. It's protected by 24 very movable bones called vertebrae, and it's inside your spinal canal. It's called your spinal cord. That's 1/3 of your brain, and we don't think of it that way.
No, we don't.
But it actually is 1/3 of your brain, and it's protected by these bones. Just like this part of your brain is protected by the skull and all the bones that make up the skull. It's pretty solid, and it's the most protected organ in your body. But the rest of your brain, your spinal cord, which communicates, off of that come 31 pairs of nerve roots that communicate with every single organ, tissue, and cell in your body. And these are the pathways, the nerve pathways, it's like the wiring in your house, the electrical pathways that bring the energy to every single organ and system and cell in your body. If there's interference to that system, or to any of that energy leaving your brain down your spinal cord to, say, your liver or your stomach or your kneecap, then those tissues in that nerve pathway aren't going to function as well as they could or should, leaving you susceptible to disharmony or dysfunction or even disease. So chiropractic was not invented but created, if you will, by Dr. D.D. Palmer way back in 1895. He was a self-taught anatomist, brilliant man, who was intrigued by a statement made by someone many, many years earlier. You might remember the old Greek philosopher Hippocrates.
Yes.
Hippocrates said, "Look well to the spine for the cause of disease." And D.D. Palmer was intrigued by that statement. And he looked into that with his anatomy studies, and he even back in 1895, they had a very good but elementary understanding of the central nervous system. We have a much greater understanding of it today, and I still think we have a long way to go.
Right, right.
But when he said, "Look well," when Hippocrates said, "Look well to the spine for the cause of disease," D.D. Palmer changed that around and said, "Well, therefore, if we take better care of the spine, we can actually prevent disease." And chiropractic was designed as a preventative to help people stay healthy, not just simply respond to getting sick, throwing a medication at it. So if we take better care of ourselves in a preventative model under the chiropractic umbrella of wellness, many people have a great chance of preventing significant diseases from fibromyalgia and any of the chronic illnesses that are plaguing us here in the United States today, including heart disease and cancer, diabetes, which are the big 3. And there's certainly more, osteoarthritis. All these, according to the World Health Organization, are preventable diseases. And if we can we as a chiropractor are not only interested in making sure that the spinal structure is working properly so as we can make sure that the nerve system is running properly, we also, at least in my wellness practice and many other wellness practices here in the States and in Connecticut, are focused on the other aspects that a human being needs to be well and healthy. That is nutrition and exercise and even a positive mental well-being, mental state of mind.
Now, you're mentioning wellness, wellness, wellness. Well, if I'm feeling really good, why should I go to a chiropractic?
Boy, you have the great questions. That's the same, if I can use another analogy, as saying I utilize a dentist to help keep my teeth clean, and hopefully I'll have my teeth the rest of my life. So that's like saying I'm only going to brush my teeth when they hurt. Or the reason I go to a dentist is, the only time I would go to a dentist is when they hurt.
Right.
I go for my regular checkups. I go for my cleanings. So I, again, can prevent disease.
Right.
So prevention isn't a new concept, but it is a relatively new concept when we apply it to our bodies. Most of us know we should be exercising on a regular basis.
Right.
But less than 14% of the population does on a regular basis. And we all know that's going to help prevent a lot of illness. So chiropractic it falls right into that same thinking, where if we take better care of our bodies, if we pay more attention to nutrition, if we exercise on a regular basis, if we certainly pay more attention to the internal structure that protects the central nervous system, which runs the show, I say that, it runs everything in your body, then you're going to have a much better shot at living a long, healthy, high-quality life.
Very interesting. Can you give me a little bit more of an idea of exactly what you do? When I walk into your office and I have headaches, or I have pain in my lower back or something like that, where does it start? What's the process?
Certainly most people would come to us because of some sort of ailment. Something's driving them in the office, symptoms talk. So back pain, headaches, those types of things are very common in a chiropractic setting. But we do get people who are simply interested in being the best they can be. And they've learned a little bit about wellness and prevention from somewhere in their lives, or maybe they've seen a show like this talking about chiropractic wellness, and they want to be more proactive in their health. So we do see people like that too. Some of the first things we would do certainly is a very thorough exam. It involves some orthopedic checks, some neurological checks, some chiropractic checks. We certainly study your posture, because posture is the window to your spine. So if someone walks into my office and their head's off to one side, or they've got a high shoulder, maybe they've got forward head posture, those are clues to someone who studies the mechanics of the spine, that they've got some mechanical aspects of their structure that are off. And I'm interested in the posture and the structure because, again, it totally relates right back to that central nervous system dysfunction that we have to be careful about and maintain properly to allow that energy flow from your brain and body, to communicate clearly with your body. So we look at structure first.
So, and if you see that structure's off, then you know something is not quite right with the spine, and you take it from there.
Pretty much so. In many chiropractic offices, including my own, we would, if we suspect that there's some structural damage, and this type of damage can come from either a trauma of some sort, you fall off your horse, or in a car accident, or slip on the ice, those types of injuries, or they can also occur just through repetitive microtrauma, which means sitting for too long in the same seat, workstation at your computer. So we're going to look for those types of injuries, and then take a look at the structure, and maybe require x-rays to take a closer look.
And this will include adjustments, which is, I know, a key word.
Once we assess what's going on, at least in my office, we'll take a close look. I'll sit with the patient. I'll tell them where I found the structural damage. We call those subluxations, or misalignments, if you will, of the joints of the spine, or any joints, by the way. Sometimes we work with knees or ankles, wrists, depending on what joints have been damaged. But again, our focus primarily is in the spine because that's what houses your nervous system. But then we certainly will recommend a series of adjustments, usually, depending on how severe the damage. And those adjustments are quite specific for each individual.
Very interesting. Dr. Don, we're going to take a short, brief intermission, and when we get back, we're going to talk about who can benefit from chiropractic care. So, okay, thank you very much. We'll be right back.
Who says you can't teach an old dog new tricks? Maybe you should go to your shelter and get a mature dog who will make your blues disappear. How's that for tricks? I got picked. Wow.
start with Rotary. Good things happen. Rotary is ordinary people working together to clean the environment, stop disease, and accomplish other extraordinary things.
Welcome back. We are here with Dr. Don from the Turning Point Wellness Center. Can you tell me who can benefit from chiropractic care?
Everyone, Ann, can benefit from chiropractic care. That is if they have a spine. Certainly we want to check everyone's spine for the existence of these misalignments, these mechanical misalignments called subluxations, primarily the vertebral subluxations, those that pertain to the spine, because of the interference that they may cause to the central nervous system and how that central nervous system communicates throughout the body. So infants should be checked because studies have shown that even in a so-called normal birth without the use of forceps or suction or C-section, that about 80% of infants while being birthed end up with a subluxation, usually in the upper neck. That can interfere with many processes in their body, leading to things like colic, for example. And we've seen infants with colic respond quite well into chiropractic care, usually within just a few visits or adjustments. After that, I think children should be checked as they grow, because we're quite klutzy when we start getting our feet under us.
Absolutely.
Other studies have shown that we've learned that when we're learning to walk, we fall about 200 times a week. Now, normally that's on a padded diaper, but other times it's forward, and on our way down we happen to graze or hit quite solidly the coffee table on the way by.
Right.
Now, the first thing parents look for, obviously, is blood. And if there's no blood and there's no broken bones, we give Johnny a little hug, and then off he goes again with that little knot in his head.
Yeah.
But we didn't realize that that knot in his head and that hit that he just took by falling may have sprained one of those many joints in his spine, leading to a subluxation that may develop later as asthma or allergies or maybe acid reflux, or maybe he's got some other maybe it turns into some digestive disorders or an irritable bowel. So these are all signs of neurological disorder that chiropractic can do a lot of help with in a natural way. Now imagine little Johnny having asthma or allergies, and of course most of us know that the allopathic approach to that, the traditional Western model, would be probably some sort of medication. Well, I have to ask everyone listening, if you have a headache or if you have asthma or allergy, do you have that headache or asthma or allergy because your body's lacking a medication? There has to be some underlying cause.
Yeah.
And that again brings us back to the difference in the training of chiropractic, where we're going to seek the cause of problems as opposed to simply treating the symptoms, the end result. Okay, because if we take care of the cause, then we do a much better job at, the body will take care of itself, because again, the foundation of chiropractic is the fact that the body is a self-healing, self-regulating organism, and is run by your central nervous system. Interference to that, we can expect problems.
It makes sense.
Continuing on with our childhood, if we survive that, we of course that's when we get involved in sports, and then there's a learning curve with every one of those too. So all these injuries can really benefit from watching a child grow throughout their life into adulthood, car accidents, right? Other injuries, slips and falls on ice, downhill skiing, snowboarding, all these injuries, and certainly I think the bigger ones, more devastating, frankly, are the repetitive microtrauma injuries. So all the way into our adult life, into our senior years, we can benefit from chiropractic care by making sure we protect the structure that protects the nerves. And that's how we can help everyone.
I remember you telling me at one point in time about some very famous athletes who use chiropractors on their team.
Sure.
And I think, you know, Lance Armstrong, I believe, is one of them.
Lance Armstrong, great. You're paying attention.
Yeah. Hey, you know,
such a great.
It's good stuff.
But yes, Lance Armstrong, people like Michael Jordan, Tiger Woods. Tiger Woods, when he was still an amateur, actually represented the chiropractic profession on the Chiropractic Centennial, when we celebrated our 100th anniversary in 1998. Tiger Woods was invited to represent the chiropractic profession on our float in the Macy's Day Parade.
Oh.
And so, yes, these world-class athletes utilize chiropractic because they know for them to be at their top of whatever game they're doing, at their job, they want to make sure that the central nervous system is running the show at tip-top shape. So they utilize chiropractic care a lot more than the layperson would, because they're at such a high level of competition. So if it can benefit Michael Jordan, I think it could benefit us too.
I think so, yes. One
thing I want to make clear, in the difference between the philosophies of the Western model of healthcare, the medical world, and chiropractic, I like to use an analogy, if I may.
Absolutely.
We call it the fire department analogy. And this actually, I'm going to give credit to Dr. James Chestnut, who's one of my mentors, and he's a brilliant, brilliant man. He's a Canadian, too. I'm sure he'd love that I plugged that. Many people still don't understand the chiropractic profession, and that's okay. That's why we're here today. What I don't want to do is say you don't need medical doctors, because we do.
Right.
And there's some incredibly intelligent, compassionate medical people out there, and I'm glad they're there. Because if I'm in a car accident and you happen to be the one first on the scene, and you saw that I was thrown from the car and I'm unconscious, my head's bleeding, my arm's severed, and I've got some big problems, that's not a good time to take me to a chiropractor.
No, no.
All right? So that's when we have some amazing people in the medical community to help save my life, to get my vital signs under control, to put whatever medications or whatever amazing technology, machines hooked up to my body, to buy me some time so that I may survive that injury.
Right.
So let's talk about, if you had a fire in your house, who of course would you call?
The fire department.
The fire department.
Yes.
And they're going to show up with certain tools, right? Axes and hoses, and they're going to put out that fire as best they can.
Right.
Now, if they were able to save some of your personal belongings, I'd be grateful, as you would. But now, after that fire's out, what's left is a soggy, smoky, smelly mess. So the crisis is over, in other words. Should you call the fire department back with their same tools of axes and hoses? And no, they're pretty ill-equipped now to fix the mess they left.
Right.
So that's kind of how it's now time to call in the carpenters and the painters and the people who know how to rebuild that home.
Right.
Right? So that's chiropractic. So if you're in a crisis, great time to call a medical doctor.
Yeah.
Right? But once you're out of crisis, you're out of intensive care, and you're mending, it's a great time to contact now, get away from the crisis people, and contact the wellness experts so that you can maximize your body's healing ability and get you back on track faster with less cost and certainly with less drugs and surgery.
Yeah.
Okay? So that's kind of the analogy I try to share with my patients so that they understand, yeah, we don't have to say goodbye to the medical world because I'm going to the chiropractic world.
Right.
But I think even my dad, being a pharmacist, kind of ironic, isn't it?
Yeah, it is.
So my dad's a pharmacist and has been all his life, and he's a very proud man and should be of his profession. But he'd be the first to admit that that most drugs don't actually create a healthier body.
Right.
They do a great job at changing physiology, altering physiology, and managing symptoms, but they really don't create health.
Right.
So what we do in chiropractic is take that to another level and bring back the basics to someone, again, regarding nutrition, exercise, movement, positive thinking, and making sure your central nervous system, which governs all healing and governs all regulation of all your body parts, is working at its tip-top shape so as to maximize your body's own ability to heal itself.
Can you give us some examples of some of the clients you've worked with and you know where they started and where you brought them to?
Sure. In my recent practice here in Connecticut of almost I'll say almost a year and a half, a little bit longer than that, one woman comes to mind. Her name is Kelly, and she started because she'd heard about chiropractic wellness, wanted to learn more, and she was really sick and tired of being sick and tired. She was depressed. She was fibromyalgic. She had pain everywhere. Her stomach wasn't working well, digestive system not working well. She was on 13 medications.
Wow.
Those are prescription medications. I can't recall if there's any additional over-the-counter medications.
Right.
She's been a patient now for just over a year. We put her on a program, a corrective care program. She certainly has subluxations, which again are misalignments of the spine that we've been working with, but we've also been working with nutrition and I encouraged her since day one to work with her medical doctors to help her slowly wean off the medications if at all possible, watching closely her symptomatology. to this day, we're proud to admit, I'm sure she'd be ecstatic to tell you that she's no longer on any of those 13 medications.
Wow.
And she's doing marvelously well.
That's awesome.
I think I always promise she's going to be our chiropractic poster child. Another story, if I may, that comes to mind was in my previous practice when I was in New Hampshire for 12 years before moving here to Connecticut. Her name is Jenna. A beautiful, beautiful 8-year-old girl who came to us primarily because of what her father learned from me in one of our initial visits. He learned about chiropractic and the importance of the nervous system, blah, blah, blah. And he got it, and he said, you know, I've got to get my 3 daughters into you because I know they probably all have subluxations.
Yeah.
Because they all are struggling with their own issues.
Right.
The youngest one, being Jenna, was the one he wanted me to check first because she was struggling, I'll say nocturnal enuresis, which is bedwetting.
Yeah.
Although hers was worse because she actually had no control of her bladder day or night. So for her entire 8 years of life to this point,
that's hard.
It was, and she's getting to that age where social things start to become more and more important. So this beautiful, vibrant little girl with an incredible smile started to have was obviously having some self-esteem issues because of this problem. And she, not only in her backpack were school supplies, but 2 changes of clothes every day. And of course her teachers were taught or knew about this situation that if Jenna's hand went up and she had to go to the bathroom, let her go quickly because she has very little control.
Right.
Well, most often by the time her hand went up, it was too late. So this little girl and she'd already been through the medical community. She'd already been on numerous antibiotics and other medications to try to help. The last suggestion from the medical community was that she needed to have some sort of exploratory surgery to try to find out why her bladder wasn't working right. Her father then happened into my office. He learned a little bit about chiropractic and wanted me to check her. Well, I did check her, and I did find that she had some subluxations. And we did put her on an adjusting schedule, and I adjusted her it was a Wednesday, I remember vividly. And that next day I had her come back with her mom to be rechecked. And that was the first night, the first dry night she ever had in her life.
Wow.
Since then, she did have some problems. She only wet herself, and it wasn't never at night again. Yeah. Only twice during the day in the next 3 months before I moved from New Hampshire back to Connecticut.
Wow.
So we made a big change in this young girl's life and her whole family's life
yeah.
by taking a closer look at what might be causing. And of course, she had subluxations that were interfering with her brain's ability to communicate with that organ, which was her bladder. And when we cleared out that communication pathway, her brain and her bladder worked just fine.
Wow, that's great. Well, you do great work. Great work.
Thank you very much. We do our best.
You do.
And you know, had she happened in almost any chiropractic setting, it probably would have ended up the same. Mm. All chiropractic adjustments work. All techniques work. Some work a little faster, some slower than other techniques, depending on how acute or uncomfortable that patient might be with whatever symptomatology they may or may not bring to the clinic. So we have to work with that and apply the techniques appropriately for each individual patient.
Well, being a client of chiropractic, I totally agree, and I think it's a wonderful thing that you do.
Thank you very, very much.
And I thank you for the time that you gave us today.
Again, my pleasure.
Okay.
Thank you.
Thank you. And thank you for watching Service Above Self. Until next time, as always, we encourage you to go out, find a worthy cause, and lend a helping hand.
Today, more than 800 million people are unable to read or write. As a result, educational options are checked, social inclusion is hindered, and a life of poverty is all too likely. So to spur advancement, Rotary shares opportunities to promote literacy. In the 1980s, Rotarians in Australia created a teaching method called CLE, Concentrated Language Encounter, and sent it around the globe. In Brazil, Rotary clubs launched a matching grant project to use the CLE method to teach children at risk. In CLE, students move from simple to complex language forms and create their own books.
The students can experience all the activities hands-on, writing, reading, and producing quality texts.
The pilot project was so successful that the CLE training was expanded throughout Brazil.
The goal we had in mind was to train 1,750 professionals.
The funding, almost $345,000, came from Rotarians in Brazil, Canada, and the United States, plus a 3H grant from the Rotary Foundation.
There are more than 200 Rotarians involved. Their involvement is huge. When they realize the efficiency of the methodology, they put their heart and soul into it. Sometimes the clubs themselves even supply materials.
That dedication has paid great dividends. CLE teachers have already taught literacy skills to more than 72,000 children. Among them is 10-year-old Angelo dos Santos.
One day, I was able to write my name, and I was able to read my name.
All over the world, Rotary shares expertise to bring the light of literacy to students like Angelo.
Our children cannot grow, cannot live, and cannot learn by themselves. They must have a helping hand.
That helping hand has given children like Angelo new ways to express their thoughts and feelings. A poem he wrote touches on his battle to overcome illiteracy.
Passei pelo fogo e não me queimei. Passei pelo gelo e não me congelei. Passei por você e me apaixonei.
And the CLE project has repaid the dedication of club members who gave their time, talent, and treasure to make it a success.
The Rotarian joins Rotary because he wants to serve others. The salary I receive spiritually is so huge that you cannot put a value on it.